It used to be when someone started a hospital, it was because there was a need. You look at your great hospitals. They were started because a community needed them. Nobody started a hospital then just to make money.
In 1910, the citizens of Southwest Georgia began a unique tradition in community health care. That year, the community came together to raise money to meet a need. The need for a hospital in the community, managed by the community, to serve the people of the community. What made it possible was a $25,000 contribution from Judge Francis Flagg Putney. What made it unique was a stipulation Judge Putney included that has remained the hospital's guiding principle to this day, that the hospital serve all persons of the community, regardless of ability to pay.
That's what a community hospital does. We exist to take care of all people in the community. All persons in Phoebe's community means everybody. It's not bound by geography. It's not bound by demographics. It's not bound by financial considerations. Anyone who shows up here gets cared for here.
In the more than 95 years since its founding, Phoebe Putney Memorial Hospital has grown into one of the nation's most outstanding community hospitals. But the goal has remained the same: to bring the highest quality health care available anywhere to the citizens of Southwest Georgia, and to make it available to all citizens, regardless of ability to pay.
At Phoebe Putney, our goal of having world-class medicine means just that. We want people to know that the care that they can get here is as good as they would get it anywhere else in all forms. 20 or 30 years ago, people routinely left here for cancer, cardiac, and complicated obstetrical services. Now all those people can stay here. The hometown commitment is that they get that with a hometown attitude and a caring approach by people who are their neighbors who happen to work at Phoebe Putney. We have a whole lot of folks here at Phoebe Putney who are here for one reason, and that's to help their fellow citizens in having a higher quality of life.
Hospitals in the United States fall into one of two categories, basically. There's the community-based not-for-profit hospitals, and then there are the for-profit sector. If there's a difficult decision which has to be made in a for-profit sector, the decision between meeting a community need or adding to the bottom line, their charter, their existence requires that they focus on the bottom line. Whereas in a community-based hospital, the decision has to be based on the need to serve the community.
As Southwest Georgia grew, so did the need for health care. Phoebe responded by adding services, and the decision was always based on one simple thing: meeting the need. In the early 1960s, cancer patients in Southwest Georgia had to travel as far as Atlanta for treatment, adding the stress of travel and being away from home to the anxiety of a devastating disease.
Filling a need is what community hospital is all about. When we started the Phoebe Cancer Center, we didn't know if it was going to pay for itself or not. What we did know was that there was a real need for comprehensive cancer treatment in Southwest Georgia. That was all we needed to know, so we made the decision to do it.
Today, the Phoebe Cancer Center is one of the largest and most advanced in the Southeast, allowing patients to receive breakthrough treatments while remaining here at home. Another area where the need was great was cardiac care. Over 20 years ago, long before other hospitals in the region, Phoebe invested in open heart surgery and cardiac catheterization. The decision to bring these life-saving technologies to Southwest Georgia was based on the knowledge that lives could be saved if these procedures were available close to home.
With acute cardiac diseases, time is very, very important. There is very little time to be sending patients to other cities for things that they need, procedures that they need. If there was not a cardiac surgery program and a cardiac catheterization program here at Phoebe, then patients in Southwest Georgia would be transferred for acute situations, acute cardiac emergencies, to centers sometimes 3 to 4 hours away. Without a doubt, there are a lot of people who are alive in Southwest Georgia today because of our cardiac surgery program.
Being a not-for-profit community hospital brings with it certain responsibilities to the citizens the hospital serves. The mission of community hospitals like Phoebe is to provide the same high level of care to every person who comes through their doors, regardless of ability to pay. A special challenge faced by Phoebe in fulfilling that responsibility is the economic and health status of the region we serve. In Southwest Georgia, the poverty level and Medicaid burden is nearly double that of the rest of the state. As a result, the overall health status of the population is much poorer. True to its original mission of providing care to all, Phoebe provides more than $50 million each year in free, unreimbursed care to those in need, more than any other non-tax supported hospital in Georgia, and far more than any hospital in the region.
During the 22 years that I served on the Dougherty County Commission, I learned a lot about hospitals, and I know that many safety net hospitals have to have tax support in order to exist. What many people don't realize, Phoebe is able to provide safety net services for the citizens of this county without any tax support.